For many nursing students, navigating through nursing school and excelling in clinicals marks a significant accomplishment. However, the journey doesn't end there. There's a pivotal exam that stands between a nursing graduate and their professional nursing career, the NCLEX. Before we get into our main topic, for all things nursing school or nursing student, make sure to hit that subscribe button. Now let's go ahead and get started. To understand the NCLEX, let's first take a step back and understand what those acronyms mean. The NCLEX, which stands for the National Council Licensure Examination, is the licensure exam that every nursing graduate must pass to work as an LPN or licensed practical nurse, an LVN or licensed vocational nurse, or RN, a registered nurse. This exam determines if a nurse meets the minimum standards to practice safely in their field. So, what are the content areas that are typically tested on the NCLEX? Those content areas ranges, but generally speaking, you are looking at some of these topics, which is safe and effective care, infection control and procedures, health promotion and maintenance, psychosocial integrity, and physiological integrity. As for who's behind the NCLEX, the National Council of State Boards of Nursing are the ones who are responsible for creating and administering the NCLEX. As for what is or who are the National Council of State Boards of Nursing? They are an independent nonprofit organization comprising of the boards of nursing in the 50 U.S. states and including the District of Columbia and the 4 U.S. territories, the American Samoa, Guam, Northern Mariana Islands, and the Virgin Islands. The NCLEX test formats. The NCLEX PN and NCLEX RN feature a total of 145 questions, including 15 experimental questions that aren't part of your score. You'll answer at least 75 questions. Now, you might be wondering, why is it that you might get different number of questions? Well, this has to do with how the NCLEX is scored. In short, the NCLEX uses a computerized adaptive testing method, or called CAT. The test adjusts its difficulty based on how you're performing. If you answer correctly, the questions get harder. If you answer a question incorrectly, the question gets easier. This up and down fluctuation of easy and hard questions will continue until the computer can determine that if it kept asking you questions, you would stay above the passing line. Lastly, it's worth noting that there are different versions of the NCLEX, the NCLEX RN and the NCLEX PN. The NCLEX RN is for aspiring registered nurses who've graduated from an approved RN program. The NCLEX PN is for licensed practical or vocational nurses who have graduated from an approved LPN program. The content areas are similar, but specifically they are aligned with keeping in mind the respective scopes of practice for a registered nurse or an LPN or LVN. Thank you for watching till the end. For more information on the NCLEX, check out nursingstudent.org/NCLEX, or if you are looking for a nursing program, you can check out nursingstudent.org/schools. Now, if you would like more information on how the NCLEX is scored, make sure to check out one of these videos.